Welcome back to this month's edition of Focus on Health. I'm your host, Dr. Barbara Brookmeyer, and today we'll be talking about preparedness. And our special guest is Rissa Watkins with the Office of Public Health Preparedness at the Frederick County Health Department. Rissa, thank you for joining us.
Thank you for having me.
So what kinds of events or situations should Frederick County residents be preparing for?
Well, our residents in Frederick County know that there are a lot of different things that can roll through our county. Everyone remembers those epic snowstorms from a couple years ago, and we routinely have really big thunderstorms and hurricanes roll through, the occasional tornado touching down, and now we can even add earthquakes to those lists. And there are a lot of different things that can affect us in this county, and all of those have the potential to put the power out for a couple days, or at least just make you stranded at home so that you can't get out to the store and replenish your stocks of things. So that's why we recommend having a kit, a type of bin that you can have at home with extra supplies just in case anything happens.
Right, so in Frederick County, it sounds like we've had enough experience to know that these situations can occur, but I'm thinking that not everybody has a kit that they can count on at home. So for those folks out there who just aren't sure how to get started, what do you recommend?
There are a lot of good websites that are out there right now. Ready.gov has a lot of great information. The Frederick County Chapter of the American Red Cross has information on their website. And the Frederick County Emergency Management website has a page that's Ready Frederick County. That's a lot of information about how Frederick County residents can be ready for their families and anything that happens. And then on the Health Department page, we have a link to a brochure that's called Plan9 that goes through 9 basic categories of things that you should include in a family preparedness kit. So just 9 things. It's not that hard.
Okay, so 9 things. So let's see, can you go through all 9 for us?
I will try.
Get us started? Okay.
Okay, so the first things most people will think of, big on the list, food. Everyone wants to make sure they have enough food. That's not a good thing to run out of if you're at home. So we recommend having non-perishable items, and you want to have enough at home for about 3 to 5 days, just in case you can't get out to the store. Think what you did for that last snowstorm a couple years ago. So you're going to want to have canned goods, dry goods, and enough for your whole family for a couple days. The next big thing on the list is water, and the rule of thumb there is 1 gallon of water per person per day. So that can get a little tricky. You're going to want to rotate that in and out, but we're coming up on summer months, so you can grab that and then replenish that stock as you need to. And then the other thing, another one of those top 9, is just an extra change of clothing and shoes for everyone in the family, just in case you can't get to your normal bedroom stuff. You need to have that ready to go.
Okay, very good. So you've covered the first 3 main essential items that people probably think about. So what are the next 3 maybe that people should have but maybe aren't quite thinking about?
Next 3. Well, as soon as the lights go out, everyone runs for their flashlights. So definitely want to have flashlights and extra batteries. Really important to have those extra batteries. Some people are going to go for candles or lanterns and things like that instead, which is okay, but you have to be really safe when you're using things like that, because when you're in an emergency, you don't want to create another emergency. So we recommend that you go with something easy like flashlights and those extra batteries. Very important. We also recommend having some extra hygiene items, so your toothbrushes, toothpaste, soap, deodorant. Families stuck together for a couple days, you're going to want that. And then, so I think we're up to number 6, we've got our first aid kit. In case you walk into that wall before you get to the flashlight, you're going to want to have something on hand so that you can patch up any little things that happen.
Oh, very good, very good. Okay, so you said that there are 9. We've got the Plan9, and you've covered 6, so that must mean there are 3, at least 3 more, but 3 more for the Plan9 that probably are less commonly thought about in advance.
Yes.
What are those?
So usually after an event, people will think of something to add to their kit. So one of those things that is part of the 9 that you'll think about after the fact is your can opener. And really important to have a manual can opener, because you might have no power and you've been really good and stocked all of your canned goods, but they're only helpful if you can actually get into them. So, got to remember the can opener. You also want to remember having extra medication. And that's an important thing that is going to take a little bit extra time and planning, because medications change, they expire, and what you're on might change also. So every couple months you're going to want to look at that and make sure that that is current and up to date. And then I think that's 8. So number 9 is a radio. You're going to want to have something like this. It's a great little radio. It has battery backup and it can have the hand crank option in case your batteries run out also. So there's the 9 things.
Well, very good. So now that 9th one that you mentioned, which is the radio, there might be some people out there asking, well, is it just for entertainment?
Well, it's always good to have entertainment. A little music might help the emergency path a little more comfortably, perhaps. But it's also really important to have something on hand so that you can keep up to date with what's going on in the county. You want to know when the emergency is over. So we recommend that you know what local stations to listen to. And in Frederick County, we've got 2 FM stations, WFRE 99.9 and Key 103, which is 103.1 FM, and then on the AM dial, WFMD 930 AM. Those stations will all have local information in any emergency.
Good. I'm glad you covered that because that is the most frequent question I hear people asking, which is, how am I going to know? How is the government going to let me know? So I'm glad that you covered that because the radio is definitely key in getting out quick messages to everybody.
Yes, it is.
So thank you. So say I've got all 9 categories of items in a bin or in some of those, in some bags. Am I prepared?
You've got a great basic preparedness kit. But nobody knows your family better than you, and being prepared is all about personal responsibility. So you want to think about your family and what other things you need to add to your kit to personalize it for you guys.
So say, thinking about my family, so say if I had an infant, maybe I need to be thinking about some infant-specific things.
Yes, everyone knows babies come with a lot of stuff, or they just need a lot of stuff. So if you think about that, if you have an infant, you want extra diapers, extra wipes, all those things that you go through normally, you're going to want to stockpile because you definitely don't want to run out of those things in an emergency. But you want to think about your older kids too. So you can plan for other things. You know, we've got the music for entertainment, but other things just in case all their electronic games run out of juice. You may want to include some coloring books, board games, puzzles, you know, a little old school fun. Hey, it might be fun for the whole family, kind of bond everyone in an emergency, but you're definitely going to want to include a couple of extra things for the kids.
So that sounds, so that personalization, that definitely makes sense that each family will want to do that. Are there some other ways that you've heard of people personalizing it to make their time in their homes more enjoyable?
Well, I think what we have covers it for the humans, but a lot of people have pets, animals in their homes, so you want to remember your pets for your preparedness kit. Anything that Fluffy or Fido need, extra food for the dogs and cats or other animals, if they're on any medication, you know, an extra leash for the dog, extra litter for the cat, other things like that. So you definitely don't want to forget your pets in your emergency kit.
Very good. You provided some very good tips and some reminders and a helpful way to get started so that it doesn't seem overwhelming. So is there anything else you'd like to add or a take-home message?
Well, as simple as those 9 things are, it's still easy to get overwhelmed by that. And so the important thing to remember is that you don't have to create your whole kit at one time. You can add to it a little bit at a time, every week, every month, and slowly build your kit. So you don't have to go out and spend a lot of money and buy everything. And you can use it kind of as a backup pantry so that you rotate things through. So it's not just stuff that will sit there and you'll never use. And that's always good to have a little bit of backup. But it's up to you to be prepared for yourself and your family for any type of emergency. So just take a moment and start thinking about those things because you are the one who gets to protect your family first.
Well, that's great. Rissa, thank you. Thank you very much for some really good tips about how folks in Frederick County can be better prepared so that we can realize the vision in Frederick County leading as a community of health and wellness. Thank you very much.
You're welcome.
And now please stay tuned for this month's Medical Myths.
Hey, look at that large group of paddlers over there.
Yeah, that's that Parks and Rec group again. Nice bunch. They're out here all summer. They do trips on the Monocacy and the Potomac.
They sure look like they're having a good time.
That's probably because the staff is so helpful and informative. Anybody can go on those trips.
Well, what am I doing out here with you then?
I don't know. Neither of us can swim, and you keep sticking me with that hook. Hey, what are you doing? You're gonna flip the... Oh!
Aw, man.
If you're concerned that there is a party taking place where there's underage drinking or drugs being used, or that you've heard that a party is going to take place, there's a tip line that you can call 24 hours a day, 7 days a week. It's 301-600-1318.
If you're crazy about flag football, like this guy behind me, you're going to want to check out all the flag football opportunities Parks and Recreation has to offer both youth and adults. Spring, summer, and fall, we run skills clinics and leagues for kids aged 6 to 12. Our adult leagues take the field in the spring and fall seasons. So if you're new to the game or trying to relive your glory days, Parks and Rec has something for you.
And now here's this month's Medical Myths. Welcome back to this month's Medical Myths. Today we'll be talking about quitting smoking with some tips from WebMD. First myth I hear a lot is, my other healthy habits will make up for my smoking. Some smokers justify their habit by insisting that proper nutrition and lots of exercise are enough to keep them healthy. Well, the fact is that's not so. Research shows that eating a healthy diet and exercising don't reduce the health risks associated with smoking, according to Ann Moliker, PhD, Senior Scientific Advisor in the CDC's Office on Smoking and Health. She said that smoking affects every organ system in the body, and thinking that you're going to find the perfect lifestyle to counteract the effects of smoking is just not realistic. Another myth I hear is, I've smoked for so long, the damage is already done. Well, the fact is, the damage caused by smoking is cumulative, which means it adds up, and the longer a person smokes, the greater his or her risk for life-threatening ailments. But quitting smoking at any age brings health benefits. Your health will even improve if you quit at age 70, according to Neil Edelman, MD, the Chief Medical Officer of the American Lung Association. The benefits of quitting start the day you stop. Within a month, you will feel like you have more air, because you do, Fiore says. Within a year, your risk of having a heart attack will be cut by 50%. Another common myth that I hear is, I'm the only one who is hurt by my smoking. Well, the fact is that tobacco smoke also harms the people around you. In the United States, secondhand smoke causes about 50,000 deaths a year, the American Lung Association estimates. It's been estimated that a waiter or waitress who works a single 8-hour shift in a smoky bar inhales as much toxic smoke as a pack-a-day smoker, Fiore says. Another myth that we hear is nicotine products are just as unhealthful as smoking. Well, the fact is that nicotine products are safe when used as directed. Even using nicotine patches or the gum every day for years would be safer than smoking. After all, nicotine products deliver only nicotine. That's in contrast to cigarettes, which deliver nicotine along with 4,000 other compounds, including more than 60 known carcinogens, which are cancer-causing chemicals. That's according to the American Lung Association. Nicotine replacement therapy versus smoking. It's really a no-brainer. Another myth that's pretty commonly heard is that the weight gain that comes with quitting is just as unhealthy as smoking. Well, smokers who quit do gain an average of 14 pounds, but the risk posed by carrying the extra pounds is minuscule compared to the risk of continuing to smoke. Another common myth, and this is our final one for today, is, I tried quitting once and failed, so it's no use trying again. Well, there's good news here, because the fact is most smokers do try several times before quitting for good. So if you've failed previously, don't let that deter you from trying again. Each time people quit, they learn things that could be useful for their next attempt at quitting. We like to say the first time you try to quit is practice, the second time is practice, and the third and fourth time, well, you get it right. You just have to keep trying. And that's this month's Medical Myths. And now here's Angie Blair with this month's health tip.
Hello, this is Angie Blair, health educator with the Frederick County Health Department. Welcome to this month's edition of Health Tips. As many of you know, the prevalence of chronic diseases and the exceedingly high health care costs associated with the management of these diseases have led to an increased focus at all levels of our society on how to make the healthy choice the easy choice. Strategies to achieve this include making neighborhoods more walker-friendly, increasing access to healthier foods at restaurants, incorporating more physical activity throughout the school day, or establishing policies that promote breastfeeding. Another approach, and the focus of today's health tip, involves encouraging work sites to adopt workplace wellness programs or to make policy and environmental changes that promote healthy choices. According to the Partnership for Prevention and the U.S. Chamber of Commerce, no matter how well decision makers attempt to manage the supply chain for medical services and/or shift a greater cost burden to their employees, their attempts will have a limited effect. There needs to be a concurrent reduction in the demand for health services through integrated prevention, risk reduction, and disease management practices. Today, a growing number of organizations understand that investing in a comprehensive health management strategy not only is the right thing to do for protecting and enhancing their human capital, but it also makes good business sense. A popular worksite wellness strategy for achieving this is to focus on primary prevention and to minimize risk for health problems, thus keeping the majority of the workforce and its dependents low risk and healthy. Why do this? As noted in Healthy Workforce 2010 and beyond, a significant percentage of deaths in the United States are associated primarily with modifiable lifestyle-related behaviors. Remarkably, more than 1/3 of all deaths are attributed to just 3 general factors: tobacco use, poor diet, low physical activity, and their influence on obesity, and excessive alcohol consumption. Maryland's Department of Health and Mental Hygiene offers Healthiest Maryland Businesses as a resource for organizations who are interested in taking steps towards creating an environment that supports healthy employees. This creates a win-win, whereby employees and their families are healthier and companies save on healthcare costs and absenteeism. Additionally, these efforts can improve morale and can help organizations attract and retain the best candidates. The truth is, the health of your workforce drives the health of your business. For every $1 you invest in your employees, you can save between 3 to more than 5 times that amount. These savings result from reduced healthcare costs, reduced employee absenteeism, and increased employee productivity. Working Marylanders spend an average of 9 hours per day at work, leading to a decrease in the amount of time available for exercise and healthy eating. So what can work sites do? Actions can range from small to comprehensive, but taking a 3-pronged approach that combines individual strategies with environmental and policy changes can increase impact. A few examples include: establish a smoke-free work site and campus policy, make smoking cessation classes available in the workplace, offer work site-based incentives and competitions, establish a wellness committee made up of employees that steer the direction of a worksite wellness program, establish a healthy meeting policy to promote the serving of healthy foods and physical activity breaks, implement healthy food and beverage standards in on-site vending machines. Worksite wellness is most effective when one uses a planned approach that involves getting buy-in from upper management, assessing employees and the environment, and then choosing strategies based on these findings. If you are an employer or perhaps an employee interested in starting a wellness committee where you work, there are a number of resources available to assist you. Consider starting by visiting Maryland's Healthiest Maryland Businesses website or the CDC's Healthier Worksite Initiative. Thank you for tuning in to this month's Health Tip.
And thank you for joining us for this month's edition of Focus on Health. Please join us next month.